Hi, everyone. Just going to give it one more minute to make sure everyone has a chance to join. Just a quick sound check. Director, are you able to hear me?
I can hear you, Zach. I'm not sure if the director can.
Thanks. Okay, I think we'll get started. So thanks everyone for joining us for this media briefing about COVID-19 vaccine in Idaho. My name is Zachary Clark and I am moderating the briefing today. Before we get started, I want to remind you that we are providing ASL interpreters for these briefings. You can hover over the three little dots to the right in their video window to lock the screen in place. Click on the layout options in the upper right corner, then click on full screen. When the full screen appears, a floating window of the panelists will show. Find the video labeled ASL interpreter. You can increase the video size by clicking and expanding. So today we'll be hearing from Health and Welfare Director Dave Jepson and Public Health Administrator Elke Shaw-Tulloch before we open it up for vaccine-related questions from media participants. Dr. Christine Hahn, State Epidemiologist, and Sarah Leeds, Idaho Immunization Program Manager, also will participate in the briefing. We will not be taking questions from the public at this time. Please note that everyone should be muted unless they are speaking. And with that, I will turn it over to Director Jepson.
Thank you, Zach. And just checking to make sure you can hear me okay.
Sound great.
Great, thanks. Welcome everyone to this week's press briefing about the COVID-19 vaccine. And just wanted to start by mentioning that we have crossed a significant milestone last week where more people in Idaho have had at least one dose of vaccine than have been diagnosed with COVID-19. The next big milestone will be when we get more people with 2 doses than we have people who've had COVID. As of yesterday, about 338,500 doses have been received in Idaho, and about 259,500 doses have been administered, and about 191,700 people have received vaccine, and those numbers will be updated on our website this evening. That means that 77% of doses that have been received by Idaho have been administered. Perhaps more excitingly, 95% of first doses received in Idaho have been administered. That means first doses are getting administered within 7 days. The vast majority of individuals are getting their second dose on time. We currently have about 55,000 second doses in the state, but we have 32,000 people that are due for their second dose this week, and 35,000 are due the next week. And keep in mind that those vaccines come in about a week ahead of time. So this means that our second doses are occurring at the rate that we would expect. This past week, the Federal Retail Pharmacy Partnership started adding 5,000 first doses into Idaho, and those are at certain Walmart and Albertsons pharmacies. This means that Idaho is now receiving about 30,000 first doses a week. There are roughly 291,000 people in Idaho who are 65 and older, including those who reside in long-term care facilities. In the 65 and older population, about 91,500 individuals, which is 31%, over 65 have received a first dose. Or said differently, we've moved through just short of a third of all those over 65 plus. This means that there are many 65 and older individuals that have received their vaccine, but there's also many more 65 and older individuals that are waiting to get vaccinated. And many of them are experiencing frustration with the process of finding and scheduling an appointment. We recognize that, and we are looking at options to improve the appointment scheduling process that can be implemented as soon as possible. The biggest challenge remains that Idaho is only getting about 30,000 first doses a week, which is far less than those wanting to get vaccinated. Everyone 65 and older who wants the vaccine will be able to do so, but those appointments will happen over the coming weeks. Finally, just a reminder to please continue to observe physical distancing, to wear a mask, keep your hands clean, and stay home when you're sick. Our overall COVID numbers look great, but it's those actions that have allowed us to have those numbers be that low, and it's important we continue those. And with that, I will hand it over to Elke.
Great. Thank you very much, Director. I have a few things I want to cover with everyone today. Some updates on the federal retail pharmacy program, information about race and ethnicity, a little bit of information on the Janssen vaccine, and then our upcoming COVID-19 Vaccine Advisory Committee meeting. So to begin with the federal retail pharmacy program, the Director talked about this just briefly, but I did want to add just a little bit more detail to that. So last week we did tell you, and the Director just confirmed, that we have 2 chain pharmacies that we have participating in this federal retail pharmacy program, Albertsons, Save-On, and Walmart. And those 5,000 doses that we talked about last week did arrive on the 11th. And I just received confirmation on a phone call I just hopped off of, and it was confirmed that we will continue to receive that same amount of vaccine, if not more. So it was framed to us as that we will always get the same or more, but never less. So we're expecting that we'll continue to receive at least 5,000 doses a week for this retail pharmacy program. Those that we did receive were distributed to 39 locations in Idaho in the following proportions. So they went to 29 Albertsons stores spread out across Ada County, Canyon, Kootenai, and Bonneville counties, and to 10 Walmart stores in Canyon, Twin Falls, Shoshone, Minidoka, Madison, and Latah counties. So those doses that are being administered are being tracked on our Idaho's COVID-19 Vaccine Administration Transparency Data Dashboard. And you can see on that site that it currently shows in aggregate that about 2% of those vaccines from this program have already been administered. For the next topic on race and ethnicity, as of Friday, we currently have the capability to accept or add race and ethnicity data into our immunization registry called IRIS. While this is not a mandatory field for patients that are coming in for the vaccine to report race and ethnicity, it is required by the vaccine provider to report it to us if it's collected from the patients. Currently, staff are working to ensure that we have the most complete data available and possible before we post it on our site, which we plan to do. And we expect to have this up on our dashboard by the end of this week or the early part of next week. The next topic I wanted to address is a little bit more information about the new Janssen vaccine. And with this, I wanted to just give you a little bit more update from what we know. Last time we talked about the fact that Johnson & Johnson has submitted to FDA excuse me, for emergency use authorization. And we do expect that they're going to conduct their review through the FDA Vaccine and Related Biological Products Advisory Committee, or VRBPAC, on the 26th. And VRBPAC reviews the safety and efficacy data. And if it follows all of the other vaccines, as we mentioned before, we do expect that this will come out the first week of March. We are even told possibly if it goes at the same pace as early as March 2nd, is what I just heard on the phone call. That's all dependent upon the VRBPAC review and the CDC recommendations around it. We have learned that for the clinical trials, there were about almost 43,000 participants in their phase 3 clinical trial. The way the vaccine will come to us, it's in a 5-dose vial, and there are 10 vials per carton and 48 cartons in a shipping container. So that's a little bit of new distribution details that we learned about this. I also learned that upon approval, even though there has been conversations nationally about 100 million doses will be distributed by June, we anticipate that speed to ramp up. After the first few weeks, they do anticipate that there will be approximately 4 million doses available upon approval. And then lastly, touch base about our Vaccine Advisory Committee that will be meeting this Friday. So we'll be meeting this Friday from 12 to 2. I know, as I said before, many of you participate and listen in on those conversations. But the things that we're going to be covering this coming week is we're going to be clarifying questions that were collected and sent out to our CVAC members. And we attempted to go through those and solidify some votes on these the last time we met, which is on the 5th, but we ran out of time. So our CVAC members took an online vote, and we'll be revealing those votes. They were around faculty and staff who provide face-to-face services at post-secondary settings, public library workers, Bureau of Reclamation dam workers, on-site apartment staff, Airbnb hosts, hotel workers, flight crews, and media that cover the legislative session in person. So those were all votes that we did not have time to do last meeting, and they did them online, and we'll be talking about that on Friday. Lastly, we'll also have CVAC learn about what's happening with national progress, such as the retail pharmacy program, the new federally qualified health center program that was just announced. We don't currently have any FQHCs in Idaho participating in this program, but they will be coming in the next, there are several cohorts that we'll be rolling out, and so Idaho will be one of those. We'll learn more later. And also the CVAC will learn more about the Janssen vaccine. They'll also learn about what's happening in the state, COVID vaccine planning efforts with the local public health districts and providers, and looking at the next phases of vaccine rollout, as well as vaccine numbers update. And then also we'll be discussing further clarifications to Idaho Group 2 that have come in, and then some pretty, I'm sure, robust discussions around population groups beyond the Idaho Group 2. So that's looking ahead into the next group to be vaccinated. Right now, if we follow the Advisory Committee on Immunization Practices, or ACIP, that would be looking at people aged 16 to 64 with high-risk medical conditions and other essential workers. So those are things we'll be having conversations about. And then lastly, we'll continue our ongoing, we call it the Day in the Life Administration Realities series that we're doing. So we're having CVAC members report out who are enrolled providers, what that looks like for them, how they actually conduct their vaccine rollout. So we'll be hearing from local public health, Albertsons pharmacies, and the federally qualified health center. Hopefully we make it through all of that information. So with that, I will echo what the director said, that we need to continue to do all those safety precautions, wear face coverings, wash our hands, keep ourselves physically distanced from one another. And we look forward to continuing these conversations with you every week. And then I will turn it back to you, Zach.
All right, we will now take vaccine-related questions from media participants. We will answer as many questions as possible in the time available. Please raise your hand in WebEx by selecting the hand icon in the lower right portion of your screen. You can also type your question into the chat area, which you can access in the lower right part of your screen. When I say your name, please unmute yourself and announce your name and media outlet before asking your question. So the first hand that I am seeing is Audrey Dutton. Go ahead.
Hi, this is Audrey Dutton from the Idaho Statesman. I'm looking at the vaccine transparency dashboard and seeing that Walgreens still is only at 47%, and then some of the other providers who were in the lower, under 50% administered are still kind of down there, and wondering if you can explain why that is, particularly with Walgreens, because I thought the state was going to be getting back doses from them.
Yeah, thank you, Audrey. Excuse me, we did receive doses back from Walgreens, and I believe that the director covered that last week when we were discussing it and had the numbers available. Sorry, excuse me. Hold on one second. Excuse me, I have a catch in my throat. But they are continuing to administer. They do have more time in their program. But I will also turn it over to the director, see if he has anything that he would like to add, as well as Sarah. Sarah for sure is closer to what is happening with Walgreens at the moment.
Thank you, Audrey. Yes, we did allocate back about 13,700 doses from Walgreens. That's actually already been done. Most of those doses have actually, that's first and second doses, so half of them were first doses, and most of them showed up, actually all of them showed up over a week and a half ago, and most have been administered at this point. And I would just note that our current transparency site, as we noted, is updated only on Monday, Wednesday, and Friday. It was not updated on Monday, and it will be updated on Wednesday tomorrow so that you can take a closer look. In addition, we've cleared up some data reporting issues with Walgreens, so we should expect that number to jump up of doses administered now that we've gotten that data reporting issue sorted out or continue to work on sorting it out. And then they do have their second and third visits where they're giving second doses. And so they do have those second doses that are on hand to finish the work that they need to do at a number of facilities. So but that number is outdated right now. It'll be updated on Wednesday, but we're feeling much more confident that Walgreens has the right number of doses to finish what they need to do, and the rest have been allocated back out to the public. But I will let Sarah see if she has anything she would like to add to that.
Sure. We have their clinic schedules, and I believe that Walgreens is scheduled for they're contractually providing 3 clinics for every site that they are taking care of, every long-term care facility site they're taking care of, and those are scheduled through early to mid-March. And so, as the director said, they're working on the second round of visits, and they'll be administering mostly dose 2. But if there are new residents, they are allowed to administer a first dose, and then at the third visit, they'll administer those second doses to the people who got first doses. So.
Okay, next question is Candace Hare.
Hi, I'm Candace Hare from KMBT. Many people have been concerned, especially after what we've been seeing in Texas, where they've had mass power outages and many doses have gone to waste. Is there any kind of a plan that we have in place that if something like that were to happen here, what would happen with those doses so they wouldn't go to waste, especially considering how few doses Idaho is receiving comparatively to some other states?
Great. Thank you, Candace. It was a little bit challenging to hear you, but I think we got the gist of the question, which is around handling the vaccines, especially as we're seeing storms causing power outages and things for vaccine storage across the nation. And I'm going to turn that over to Sarah, because we have been working on a lot of robust plans with our providers to help ensure that we have appropriate storage and handling.
Sure. So as part of the agreement that every provider has to sign when they become a COVID vaccine provider, they have to have the appropriate storage for each type of vaccine, and that includes temperature monitoring devices, digital data loggers. And so if power were to go out and they did not have a backup source like a generator, they would know about how, whether there were temperature excursions in their storage equipment, and then they would have to take the appropriate steps to dispose and report those doses as wastage.
Okay, next question is Katya.
Yeah, hi there. This is Katya Stepovic from KTVB. And we listened to the AARP meeting today and heard a lot of frustration, particularly from those 80 years and older, just getting angry.
Can anyone hear me?
Yeah, I can hear
Yep.
you.
We're having some internet issues, it appears.
Zach, I am back on.
Hi, I'm
Looks
here.
like
Can
we
you
are
hear me?
good to go.
Yep.
Yes.
Okay, great. For me, it was in the middle of Katya's question that the internet appeared to
Same.
have went out.
Yes.
Okay. So yeah, I was just asking, following the AARP meeting today, hearing constant frustration from people 80 years and older wanting to get the vaccine but not able to do so. And we, healthcare providers as well as the media, is constantly saying that their patience is needed. But what can you say to reassure, those elderly people at high risk moving forward that there is light at the end of the tunnel?
Yeah, thank you. Yes, we are making strides to make sure that anyone who wants a vaccine will get a vaccine. And I know the director participated in that AARP call, so I'll let him take that response and round it out. But we want to make sure that, yes, while the message is about being patient, which is an important point that we need to continue to make, we are wanting to make sure that everyone who wants a vaccine is able to get a vaccine, and we want to be able to make sure that vaccines also get to where people are, especially for the elderly population who may not have access to be able to travel distances to get to where they need to go. So we're working feverishly to make sure that we can get vaccine rolled out as quickly as possible. But I'll turn it over to the director, and hopefully our connection is all okay.
All right, I think I'm back on. It sounds like I wasn't the only one that had trouble there. And Katya, it's a great question. As you heard on the AARP call, there's understandably some frustration on the part of those 65 and older that have not had a vaccine yet of trying to get an appointment. And I will just reiterate, anyone who wants to be vaccinated, that will happen. It will happen over the next couple of weeks here for that 65 and older crowd. We are taking steps to try to alleviate the scheduling problems and frustrations and challenges that population has had. One of the things that's coming is that to date, we've only been able to get a week's worth of vaccine. How much is coming in the next week, which really means providers can only schedule 1 week at a time. And that then causes people to have to come back to those websites or those phone lines over and over and over to see if there's an appointment available. Moving forward, the federal partners are going to be providing us 3 weeks worth of vaccine distribution information. And as that comes in, we will share that with the health districts and then with providers. And that should allow them to start scheduling 3 weeks worth of appointments. And that'll make it a little bit easier for people to get an appointment because the providers can schedule out 3 weeks instead of just 1 week. And we think that'll bring some relief. In addition, we continue to work with the health districts and the healthcare providers that are giving vaccines to try to find solutions that can alleviate the frustration and anxiety that is out there around trying to find an appointment. One of the chief causes of that anxiety is going to a website and then finding no appointments are available, and then having to come back on an hourly or daily basis to check that. And so what we're working on is some way to only have to have them check once, and so we then can let them know when something might be available. So we're still working through what solutions might be for that with our partners at the public health districts and with the providers. But again, please know that the main driver is we're only getting 30,000 vaccines a week into the state. There's still a couple 100,000 people over 65 that need to get scheduled. And we're doing everything we can to try to make that scheduling process as easy as possible, that they will get vaccinated. That opportunity will be there.
If I can just add one more to that, would you suggest to people if they are letting people 80 years and older to go first? I mean, I guess, how do we organize and get ahead of it since we are so limited?
Elke, I'll take that. Obviously, at this point in time, the group that's recommended by CVAC and approved by the governor is 65 and older. That's really up to each provider to how they approach and tier that out and for those age groups and older. And I do believe there are some that are taking that approach. But at this point, it's the expectation is out there of 65 and older. and that's really the group that's eligible at this point. We would encourage providers to make sure that they get those that are the most vulnerable in as quickly as possible.
Okay, next question we have Nicole Camarda.
Hi, this is Nicole Camarda from Idaho News 6. We got an email from a viewer that's in the Twin Falls South Central Health District, and they're saying that providers are unable to give them the second dose within 28 days. I wanted to check and see if you guys had any information on this, how long they can go without their dose, or if there's any, what they should do, any related information on this.
Yeah, thank you, Nicole. I've not heard that to be the case, and it could be potentially just a specific provider that is not prepared for that second dose at this time. But there is some leeway, and I'm going to turn this over to Dr. Hahn. She's been working on this, some leeway between that window of opportunity to get that second dose. So I'm going to hand it over to her.
Yeah, hey, thank you. And thank you for that question, because it's a really important one. There are many reasons why a person might not be able to get that dose on time. Sometimes it might be provider, just logistical scheduling issues. Sometimes it might be you're sick on the day of that when you would normally get your second dose and you really shouldn't be getting vaccinated, or you're trapped, hopefully not too many people are traveling, but you might be just unable to. So the CDC has advised that it is recommended to schedule up to 42 days after that first dose is considered acceptable. Obviously we all want to stick as close as possible to the way the studies were done, because that's where we have the most solid science, but up to 42 days is considered okay. And even if for some reason that wasn't possible, most experts say that, it's probably always good to get that second dose, even if it's later than that. And like Elke, I have not heard about that specific problem. So we'll certainly look into it and see if there's something we can do to help. But I wasn't aware that there was a problem in that part of the state right now.
Thank you. Yeah, if it helps, it was the Twin Falls South Central Public Health District. I don't know if it was what the exact provider was, but it was in that area.
Great, thank you.
Mm-hmm.
Okay, next up is Audrey Dutton.
Sorry, I didn't lower my hand.
Next, Kyle Fahnensteel.
Thanks. This is Kyle Fahnensteel with the Post-Register. Director Jepson, I wanted to ask about something you mentioned. How many of the 65 plus group have been vaccinated? Do you have a breakdown of how many of them are seniors living independently or seniors inside long-term care facilities?
Kyle, thank you for that question. We don't have a clean way to break that down between those that are in long-term care facilities and those that are not in long-term care facilities. We do, as I mentioned at the beginning of the call, we do know that approximately 91,500 of those individuals 65 and older have been vaccinated. If we look at the numbers that we have for Walgreens and CVS, we think that's at about 7,000 of those are from Walgreens and CVS. We also know that there are many long-term care facilities that were vaccinated by other pharmacies. So that's definitely not a total number from long-term care, but that's the best estimate that we have. So we have about 91,000 that are vaccinated, 91,500 that are vaccinated with at least a first dose, 65 and older, and we know about 7,100 of those were from CVS Walgreens efforts at long-term care centers. So we don't know exactly, but that's the best information we have at this point.
Next up is Shira Matsuzawa.
Hi, can you hear me?
Yes.
Yes. Hi, Shira from KTVB. So we were just talking about long-term care facilities. We've heard that in some of those centers or facilities that most of the residents or all the residents have been vaccinated, but there are staff members who may have opted out of being vaccinated. And as a result of that, some residents are being forced to still maintain that social distance and maybe eat alone. Can you talk a little bit about that and maybe any recommendations you might have when it comes to this particular situation?
Yeah, that's a great comment. We have heard that some of the staff members are not taking the vaccine, but we definitely are working on our messaging, our communication with staff to make sure that they get the vaccine. Of course, it's not mandatory, but we are trying to address what could potentially be making that hesitancy, and that could be maybe they want to take a wait and see approach. But I know that we have many members of our team and the health districts working with long-term care facilities to approach that. We're also waiting on some CMS guidance around the need for continued isolation after vaccines. And I'm going to turn part of that over. I know Dr. Hahn has been following some of the conversations around CMS guidance, and I will let her address that. And I'm sure Sarah probably has some other information around that out.
Yeah, thank you, Elke. Yeah, the long-term care facilities, of course, continue to be a real important focus for us. As you know, if you're fully vaccinated, even if everyone was vaccinated at that facility, the recommendation is to continue some social distancing, mask wearing, et cetera, in community settings, and as much as possible in long-term care as well. So it's not a surprise to hear that some of those social distancings are still being enforced. You know, even in the best of circumstances, we knew that would happen. The details, of course, of what's happening at a particular facility, we wouldn't necessarily know. We do have a long-term care strike team, you know, as you're probably aware, that has been working on a lot of these issues. As Elke mentioned, the Center for Medicare and Medicaid Services is expected to come out with some more specific guidance for, there are so many long-term care facilities around the state right now that are in, or around the country, that are in that exact situation right now. They have some folks vaccinated and maybe not everybody. And even if everyone were vaccinated, then the next day they admit a new resident, and that person may or may not have been vaccinated previously or may have only received their first dose. So it's going to be a constantly adjusting process. And certainly we do hope that people can get back to some sort of normal, have visitors and things like that start to happen. But we are waiting a little bit. We don't want to be cross purposes with CMS. So we are kind of waiting to see that guidance. And, you know, if it came out in the last few days, I might not be aware of it. But last I checked last week, that was not out yet.
Thank you.
Okay, next up is Nicole Foy.
Thank you, Nicole Foy from the Idaho Statesman. Are you seeing in the vaccine data that people are traveling across counties to get vaccines? And are you concerned about that happening since the rollout is required to be equitable and vaccine sites in places like Walmart's in Canyon County were intended for underserved populations in those areas?
Yeah, thanks, Nicole. We do expect that there's going to be some travel and movement, of course, to go from where you live to where you need to go to get a vaccine. The providers are located in, they might be located, and that's part of the reason too why you see on our dashboard two different ways of tracking the data. And I believe the director reviewed all of that last time and described that. But I think philosophically, our approach is we want everybody to get the vaccine. If we don't want to make it so burdensome that they must stay in their own particular area. The more people who can get vaccinated, the better, the more protections we have for people. But we are trying to keep track of that, of course, and see where people live compared to where they get vaccinated. And that's a constant conversation that we're having with the local public health districts is to make sure we don't have barriers there for people, make sure we're going, as I mentioned earlier, getting to where people are, getting that vaccine out to where they are so they don't have to travel, making it much easier for them. But it's an ongoing kind of iterative process to make sure that we're managing all of that.
Next up is Melissa Davlin.
Hi, Melissa Davlin with Idaho Reports. I had a question on the race and ethnicity data collection. So I understand that IRIS is now set up to collect this information if the patient so chooses. Are providers required to ask the patient, and is there a uniform training or data collection question list of questions that everybody asks regardless of which setting they're giving the vaccinations in?
Thanks for the question. I'm going to ask Sarah to weigh in on if there, or Dr. Hahn, if there are particular data fields that are required in that provider agreement. I don't have the visibility into that. That would then standardize across all enrolled providers. So I'm going to hand it over to Sarah first, and then Dr. Hahn, if you have anything to add.
Sure. Thanks, Elke. Yeah, so providers are required, it's part of the agreement to receive vaccine, that they report race and ethnicity. And so even if it is a, unknown, patient reports unknown, that gets reported. And so as you mentioned, Melissa, that IRIS now has an upgrade that it will collect that information that comes in, both either as an electronic data exchange or through hand, if a provider is hand entering that data. And so we are now collecting that, and then providers have a way to report that to CDC as well.
I think part of the question, Sarah, was if there's a standardized list, for example, of races or ethnicity that people use to collect that information.
Yeah,
providers are required to ask that of people.
Yeah, so I want to make sure I'm answering or understanding the question correctly. Is it a standardized list of race and ethnicities, or a standardized way to report? Is that what you're asking?
Is there a standardized set of questions that the providers are required to ask of the recipients of the vaccine? So in other words, I know that you have the setup on IRIS, but are they required to ask and give the patient the opportunity to provide that information or turn that down?
There are a few that are, they've got to do a screening, clinical screening, and look, ask for contraindications. There are. I'm going to have to get back with you about the mandatory set. I can't remember from the provider enrollment. I haven't seen that in a couple weeks for that, and I'll try to get that while we're still doing the press briefing.
Next up is Erica Lee.
Hey, can you guys hear me?
Yes.
This is Erica from CBS 2 News. Something I've been hearing is about double booking for meetings with multiple providers and how that contributes to vaccine shortage. How much does that contribute to the vaccine shortage? What are you guys doing to prevent it? And do you have any just other facts and figures on that?
Thank you. We do know that people kind of worried about not being able to get an appointment are trying to schedule appointments at multiple locations just to make sure that they get one of them settled. While I wouldn't necessarily consider it using up too much vaccine, that does then put that provider at risk of having what they thought was a scheduled appointment, and now that appointment is empty. And if they can't then backfill that appointment, then it does lead to a risk of that vaccine being wasted. So one of the things that we've been trying to promote with folks is not only the concept of patience, because there's a lot of demand and lesser supply, but we also want to make sure that if people are sort of shopping around for the appropriate, at a location to get their vaccine, that if they have scheduled an appointment and they get one at a second location, or they find that other provider, that they call the original place and ask to be taken off the schedule. So then those providers can quickly fill those spots, and we can make sure that their administration day really rolls out flawlessly, and they can keep all those appointments filled with people who will actually show up. So if you make an appointment, keep that appointment. If you make multiple appointments, cancel the one that you're not going to take, and be patient is what we're telling. We don't want to waste any vaccine, and we don't want to have providers scrambling at the end of the day to fill those spots.
Okay, next question, Candace Hare again. Go ahead.
Oh, sorry, I didn't have another one.
Oh, okay. So yeah, if you have asked a question, just be sure to put your hand down. Or if you don't have another one, I see Nicole Foy. Do you have another question?
I do, thank you. So it's kind of a follow-up to my previous question about people traveling maybe out of their areas to go and get a vaccine, in an area that you know, is maybe not in their county or sometimes not in their health district and was specifically meant for, you know, underserved populations. And so I guess, like, what are you doing to guarantee or directing providers and health districts to do to guarantee that people who are already under-resourced and underserved are not going to have to wait extra months to get those vaccine slots that were intended for their community, and they don't have, you know, maybe the English language skills to get that quickly. They don't have time out of busy job schedules or people who can help them navigate complicated sign-up systems.
Yeah, thanks for the additional question on that. You know, we're working a lot with our local health districts. You know, all the vaccine is allocated to each health district based upon their proportion of the population that we're serving. So we've talked about that in past press briefings, and so, you know, we do want to make sure that we have those messages out there to the best of our ability to, you know, encourage people to stay within the group that's being you know, vaccinated right now. We want to make sure that there is fairness and equity when it comes to everybody gets their turn. You know, all those messages around patients. Definitely with the district health directors, we've talked a lot about the need to provide additional language support, whether that's through people scheduling those vaccines to help them navigate that, that we have information available in multiple languages, and that we're also using our community partners to help us target those groups as well, to help the people that are in those communities navigate, you know, where the vaccine is located and how to get it. So I would say, is any of this perfect? No, it's not perfect, but you know, we're definitely very keenly aware of what needs to be done, and we're working with our community partners to help us navigate that and get people to where they need to be.
All right, that appears to be our last question. Not seeing any questions in the chat. So just one last opportunity, no raised hands. So with that, seeing no more questions, we will wrap it up for today. We're planning another media briefing about COVID-19 vaccine in Idaho at 2:30 p.m. Mountain Time, Tuesday, February 23rd. Watch for those details on Monday. And thanks again for joining us today.